Hi, this is E. David Crawford, Editor-in-Chief of Grand Rounds in Urology. It is my great pleasure to introduce Vlad Mouraviev. Vlad is going to become one of our section editors in Grand Rounds in Urology, and one of our educational portals dealing with next generation imaging and bacterial and other infections. Vlad is being honored this next week in Barcelona during the European Association of Urology meeting. He has 2 posters that have been accepted and have been awarded Best Poster in the area where he is presenting it. I've asked Vlad to give us just a brief look into these 2 posters dealing with next generation sequencing of semen samples and prostatitis, and also infections following prostate biopsies on what he's going to present. Vlad, welcome aboard, and thanks for taking the time to do this.
Dr. Crawford, thank you so much for introduction of our teamwork, and that been awarded actually best posters at European Association of Urology annual meeting in Barcelona this week. And first poster, I would like to walk you through our novel approach, how we can improve prophylaxis of severe urinary tract infection using new generation DNA sequence in order to better detect all pathogens of the rectal microbiota. It's been done rectal swabs for all 68 patients in 2 weeks before scheduled prostate biopsy. And in 1 week, we received results, comprehensive results of the rectal microbiota that is being presented in the figure 1, when you can see the predominantly with the Enterobacteriaceae family, including bacteroids, is Escherichia E. coli, Prevotella species. Most important clinical-wise, that we also search multi-drug resistant genes to the different antibiotics. And in this regards, we found that multi-drug resistance in 69% of the men, and especially fluoroquinolone resistance was detected in 47% of cases. Secondly, actually resistant to the beta-lactam was detected, and associated resistance to the fluoroquinolone and beta-lactam as more frequently used antibiotic for the targeted prophylaxis was detected in 31% of the cases on figure 2. Now we also found, as you can see in figure 1, the high prevalence of the fungi species, more than 40%. Therefore, we add antifungal antibiotic if we received presence 2 or more fungal pathogens in rectal swabs. Finally, this approach allowed us to avoid serious infectious complications such as urosepsis, bacteriecemia in all patients within 30 days after biopsy, and it can be considered as a promising approach for more improved prophylaxis of severe urinary tract infection as a kind of precision DNA-guided therapy. In figure 3, you can see how it was done switch from empiric and targeted to the individual DNA-guided therapy, which big proportion of the cases we really individualized treatment. So in our second poster, we applied this next generation sequence DNA technology to investigate the semen microbiota, and we found the average number of the microorganisms present in each specimen of the semen as 4.4 species with a range from 1 to 10, and resistant genes to the different antibiotics were detected in 4 of 17 samples. And most common predominant bacteria was gram-positive, including Enterococcus faecalis, Staph epidermidis, and Hemolyticus and Strep midis. In 6 of 70 patients, we detected mixed, and in 2 of 17, truly gram-negative pathogens, including E. coli and Serratia marcescens. In 2 cases, we detected high bacterial load, in 4 moderate load, and in 11 pretty low load, because it was patients who already received multiple antibiotic. That makes the bacterial load really low. In other words, at the conclusion, this kind of therapy allowed us just to individualize again treatment of the chronic bacterial prostatitis. As you can see, actually, sometimes it's predominance of the low load bacterial agents actually can guide it to use non-antibiotics alternative treatment option for this cohort of the patients. Thank you so much for your attention.